Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hello, ladies and gentlemen. This is the Bridge of Health, and I'm Dr. Thomas Dow, Jr. I'd like to introduce a special friend of mine today. The reason for this show is most patients, they go to doctors that don't communicate with each other. The show is designed to not only educate patients, but to tell the patients a little bit about what we do as professionals working hand in hand with one another. I'd like to introduce my friend today and also co-worker, partner, Krishna. He's a physical therapist. And thank you for coming on our show.
Thank you so much
Krishna,
for having me.
Tell us a little about where you practice and what you do for your patients.
Okay. My name is Krishna. Everybody calls me KK. I'm a physical therapist, and I've been a licensed New York State physical therapist. And we have, I practice mostly in integrated offices with a team of other healthcare professionals. My approach for treatment is a patient-centered approach. We wanted to see that every patient gets the best care in the best possible healthcare practice situation. So my goal is to work with the patients to give the best treatment possibly they can get. And we do that in an integrated office with a group of chiropractors, acupuncturists, massage therapists, medical doctors, and all these together.
So integrated basically means that you're a professional, and you're working hand in hand with chiropractors, other physical therapists, physical therapy aides, pain management doctors, orthopedic surgeons. How is your results with that type of approach? Have you been in any other approaches before? Or?
Yeah, I've been in an independent approach. I've worked in different scenarios and things like that. I've been an independent practicing physical therapist for a long time. My approach is the patient has the best benefit when we are an integrated medical office. The reason is there is better communication between healthcare professionals. We talk much more about the patient. Physical therapy is not. It's an option, treatment option for certain medical conditions and things like that. We won't be, am I able to treat 100% of my patients with my single approach? No. Sometimes the patient, every patient is different, their symptoms are different, their clinical condition is different, their background is different, their comorbidities are different, everything is different. And in an integrated health approach, what happens is I have better communication with healthcare professionals. I do have patients who come with severely acute pain, and sometimes they get referred to my office by their orthopedic surgeon or by their primary care physicians. But the patient is not ready to start rehab. The goal of rehabilitation is to relieve pain, restore movement, and revive the function so that the patient can go back to whatever he likes to do.
Okay.
In that approach, although it is our goal, but sometimes we face difficulties. A patient comes to us in acute pain, or it comes with a misalignment. And for us for the patient to be rehabbed at that point of time, we find it really difficult because he's in too much acute pain.
Okay, let's start off from, I'm a patient, I'm walking into your office now, and I have lower back pain.
Okay.
What can I expect from you? Are you the first person that I see when I walk in your office, or do I see other different professionals, and then they refer me to you? Let's touch on that a little bit.
Okay. For the last few years, physical therapists have become direct access providers. Most of the states now accept the patient to be seen directly by a physical therapist. In the state of New York, they passed a legislation a few years ago where a physical therapist can directly see. But even still then, most of my patients these days actually are referred to us by other healthcare professionals, medical doctors, and things like that. So when a patient comes to me with a low back pain, my job is to first evaluate the patient to find out where he stands in terms of health and things like that. So we do a one-on-one consultation with the patient. We take his history. We just talk to the patient about what his complaints are and things like that. So that gives us a picture to understand what kind of process or pathophysiology is actually causing the problem. Then we look at sometimes the patient may already have received X-rays or MRIs and things like that. So we go over those reports, we try to observe the findings and educate the patient, and we also tell the patient, what the treatment plan is. So we as physical therapists, our philosophy of treatment is mostly basically musculoskeletal and biomechanical aspects of a medical condition or a diagnosis. So we evaluate that. And to that factor, low back pain is, most common causes of low back pain is mechanical low back pain. Most of the patients do come with acute low back pains and things like that. Statistically speaking, low back pain is only second to common cold that people get affected with.
I think statistically, the amount of people, I think it's about 70 or 80, if not more, 80% of people will experience lower back pain in a lifetime.
Yes, that is
and
true.
that's a pretty high statistic.
Yes, and what statistically and research also says that most of the low back pains are mechanical in origin rather than pathological in origin.
Okay, so
And
you're well equipped to handle that?
Yes.
In your office?
Yes.
Okay, so what are some types of things that you would start a patient on as far as therapy for something like that?
In our office, we being an integrated office, we offer a comprehensive approach. So we start with the physical therapy treatment plan. For acute patients, we offer spinal decompression therapy, which is the most advanced treatment option.
And what does that entail?
Spinal decompression therapy is a treatment modality or a treatment option that we use for patients to decrease the tension on the spine. The spinal disc, if you look at the anatomy of the spine, the spine is made out of
It's bones, and then you have a cushion in between the bones,
called
right?
the discs.
Yep.
And the basics of it is the lumbar spine. When you're talking of an example of a lumbar spine patient, the lumbar spine, because of the mobility in the lumbar spine, whenever there is mobility, there is decreased stability. That's the basic law of physics. When something is too mobile, it's unstable. So that's the reason why patients, if you look at your spine itself, your neck is more mobile than your lumbar spine. So people have more history of neck pain when compared to their low back pain. And your thoracic spine doesn't have that much mobility, so it's much more stable. But when you come back to the lumbar spine again, your lumbar spine is very, very mobile. That's the reason why you have a lot of less stability.
All right, so you mean it moves a lot more than the rest of the spine?
The rest of the
right?
spine,
We're
yes.
bending, we're twisting,
Twisting,
we're picking things up
turning,
from the ground.
and things like
So that's the reason that the lower back, people have it more in lower back than the rest of their spine.
The rest of the spine, yes.
All right, let's talk about where your offices are. Where do you practice?
We are always an integrated office. We have 3 office locations. The name of our practice is United Rehab Physical Therapy. The purpose, again, when we name the practice, when we say United Rehab, that's what our approach was. Our approach was to unite all the services together, to be in hand with everybody else.
Well, that's the ideal
That's
approach,
the
right?
ideal approach.
Because I think the patient will benefit a lot more from the integrated approach than having only one doctor there and having to chase back and forth with phone calls. As we know, we're very, very, very busy during the day, and it's hard to get a doctor on the phone.
Yes. The great advantage of a integrated approach, what I found is that there is better communication. Supposingly all my patients come, sometimes they're coming referred from somebody else and things like that. So when they come in, most of the time, I don't find the reports. The MRI findings are missing, or there is no communication. There is no health history from the patient from the previous doctor. In our office, the patient, because it's an integrated approach, our healthcare professionals have medical records available on site, so it's very easy for me to communicate. And some of the times, the patients doesn't get better within a few visits with physical therapy. At that point of time, I have the freedom to actually, because the physicians are in the office
Within
once
the
a
office,
week,
right.
and the things like that. I can bring the patient to an acupuncturist and say, hey, look, he's not benefiting from physical therapy at this point of time. And acupuncture has been proven to be very
Absolutely,
effective.
yeah. I have patients myself that have benefited greatly from the acupuncture as well.
Yeah. So
so it
what
is
we
a-
try to do is, we bring back the patient to the acupuncturist. We explain them, hey, look, I've got this patient with so-and-so issues, and they are in acute pain. Physical therapy is not helping them at this point of time. So we try to, help, take some help with the acupuncturist to help us in a way where the acute can be relieved, so that the patient can actually go into the next phase of rehabilitation,
Perfect.
which can be strengthening.
Let's touch on some of the other modalities that are used by a physical therapist, like electrical stimulation, heat therapy. ice therapy, ultrasound, and a lot of people think of ultrasound as being a diagnostic thing that look at babies, but there is a component of ultrasound that actually could heal tissue, decrease inflammation, and actually help a patient out. So let's touch on those things that you do in office, hands-on with the patients to get them better.
The goals of all the modalities, we classify them as modalities in a physical therapy practice. And the goal of all these modalities is first thing is to relieve pain
Right.
and control inflammation. So we may choose different, based upon the type of inflammation the patient is complaining about, we may choose the type of modality that we want to use. In acute cases, we use cold compression therapy. Cold and compression are supposed to be the most effective treatment of acute pain.
To bring it down, right?
To bring it down
Yep.
and things like that. So in our office, we also offer Game Ready, which is a cold compression therapy system. I think we are the only facility in Long
I've
Island.
heard of that, yeah.
In Long Island to have
Now
that treatment.
that's a pack, and it actually circulates. They have different parts of the body that you could apply this to.
Yes.
And it will actually compress and give the ice therapy at the same time.
Yes. Compression, tissue swelling especially is a big contributor to pain. We always think about swelling to be external and things like that. But whenever the tissue swells up, it actually produces pressure on the tissue. It's actually that pressure on the tissue that causes acute pain. So we have been using ice as a modality for so long, but we have never incorporated a compression component into it. We are only able to do that with an ace bandage or some kind of things. But for the first time, this Game Ready system is able to allow us to apply cold and compression
At the same time.
At the same time. The benefit of this cold compression therapy at the same time is the Game Ready system. Why it is so unique is that it delivers treatments through body-specific, anatomically specific wraps. Previously, 5 years ago, 3 years ago, what we were doing is we were applying ice only by a generic wrap. But right now we have wraps available specific to the areas of the body, like the left shoulder, right shoulder, knee, high hip, thigh, ankle, wrist, elbow, you name it. Even they are coming out with specific things for the cervical spine and lumbar spine also.
All right, so have you been referred patients by an orthopedist for, let's say, a rotator cuff problem, sprain, strain, or a ligament strain in their knee? This machine, it's called Game Ready.
It's a Game Ready cold compression.
It has a
It's
name.
the name of the company.
It has a name that's associated with sports. I think it's often misconstrued that this is only for sports patients. This can be used on pretty much anybody, right?
Yes, absolutely. The biggest advantage that we see with this machine is actually post-surgical patients. The patients that have had surgery who are coming with acute swelling. In those patients, we are unable to, it's extremely beneficial. I have had great success in treating total knees, total hips, shoulder repairs and things like that with this machine, because the compression provides that component to reduce tissue swelling, and the rate of recovery is much more faster. There are studies which have proven that if you can control the swelling in the initial post-surgical phase, your tissue repair happens at a much accelerated pace.
Okay.
So it has benefited those things. Same thing with, we talk about ACL reconstruction surgeries in athletes and things like that. And it also proven to be very effective in the treatment of acute sports injuries. And right now, Game Ready is mostly used by all professional level NFL
Right.
teams, Major League Baseball teams. You take any sports league that is out there, they're using the Game Ready systems. You take about college sports to professional sports, everybody's using Game Ready. We are one of the few practices in Long Island who have it in our office with no extra cost to the patient. And that's one of the modalities.
Excellent.
And we talk about also other treatment options. We talk about electrical stim. Electrical stim is a application of an electrical current to the human body to reduce pain, to reduce muscle spasm, to increase muscle tone in certain conditions. If the patient has muscle wasting associated with disuse, atrophy, or things like that, we can also apply electrical stim in a different format to increase the muscle tone and things like that.
Right.
Then we use ultrasound therapy. Ultrasound therapy is a therapeutic application of sound waves to bring about certain changes in the human body. And there are different formats in it. There is different wavelengths in it. We use mostly 1 megahertz and 3 megahertz frequencies. We use them in continuous mode and pulsed mode. Every specific treatment depends upon what stage of inflammation the patient is.
So this type of treatment, the ultrasound, is actually to decrease the inflammation as
Yes.
well, right?
There are, a pulsed ultrasound is a non-thermal application of ultrasound. The pulsed ultrasound is used mostly in acute injuries. A continuous ultrasound generates heat, so it is used in the most treatment of muscle spasms, if there is scar tissue mobilization and other aspects of care.
Perfect. Now I want to talk about one more thing. I do practice sometimes with you, and I do see you do a lot of hands-on. That's your approach. You do more hands-on physical therapy than you try to lean away from the modalities and do the hands-on therapy better. Is that your philosophy, or because I
Yes.
see some physical therapists only use the modalities, but I see you doing stretching to them. I see you, lifting their legs up and doing a lot of stretching, and also doing a lot of muscle building.
Yes.
Let's touch on that a little bit.
I believe that physical therapy should be done one-on-one, and I believe that's the best approach of treatment. You're going to have excellent results.
Absolutely, yep.
Excellent results when you do an individualized treatment program that is specific to a patient. There are different patients. There is no one golden rule for treatment. Every patient has to be individualized. That's the reason why it is called therapy, not medicine. Therapy has to be individualized, and that's where most of the experience of physical therapists comes in, to individualize therapy. We also we set up treatment goals based upon each individual treatment goals. A patient wants to go back to playing golf. A patient doesn't want to go back to this thing. A patient just wants to climb his stairs at home. When we individualize treatments, our outcomes are much better and patient satisfaction is much better. So as a part of that individualized treatment program, we feel that hands-on therapy, the basis of physical therapy, the evolution of our profession itself is on the basis of hands-on therapy.
Sure.
So that's our approach to treatment. And hands-on therapy is we are able to understand how the muscle is responding to a certain movement, how a muscle is responding to a certain activity. We are able to understand it by the feel and things
Right.
like that, and we will be able to modify that.
I also think there's a doctor-patient relationship
Yes.
where they will benefit more from the hands-on therapy than being just hooked up to a machine and left there for, let's say, 15 or 20 minutes. There is a kind of relationship component that they will benefit from.
Yes. In our practice, our modalities are actually helping us only to decrease the pain. It will be the hands-on treatments that bring about the pathological changes or the physiological changes in the body that would help the patient in the long run.
Okay.
So supposingly we talk about low back pain. Some of these patients have severe muscle spasm of the low back muscles. Just applying modalities is decreasing the pain, but you're not stretching the tissue.
Absolutely.
You need to bring about a mechanical change in the tissue or a length in the tissue. You have to improve the length of the tissue for it to work better, for it to function better.
Okay, let's tell the audience a little bit about what we do in our office as far as the chiropractic work and the physical therapy, because a lot of people will just think that they need to see either a chiro or a physical therapist, and that'll be good enough.
Well, yes, those are, unfortunately, because everybody is in individual practice, that's the approach most commonly. But what in my experience, what I have seen a lot is that a patient gets best treatment available, or he is the winner in this case in an integrated office. The reason
When they do
being-
both the chiro and the physical therapy
Yes,
at the same time.
yes.
And why do you think that is? Because I have the same results. I find my patients getting better when they do both the chiro and the physical therapy. Even though we do some of the same treatment and we're certified to do some of the same modalities, there's a different component from chiro and there's one different component from physical therapy. And a lot of the times people don't get both, either because one's not doing the other, but they do need both to get to being well.
Yes.
So let's touch on that a little bit.
So let's take an example of your low back pain. In most of these patients also, the approach of treatment, whether it is physical therapy, chiropractic, acupuncture, is different. But the ultimate goal is for the patient to feel better. So let's talk about low back spine itself. And some of these patients that I see come with a aligned spine or a inflamed disc and things like that. And I feel that the chiropractic adjustments will help the patient in relieving the pressure of their discs, so it will put the alignment back into position and to help regenerate the nervous system, so that there is increased blood flow to the disc, there is, nerve
Absolutely,
regeneration
yeah.
happening and things like that. That's your approach of treatment. My approach of treatment in those cases is to, once the adjustment is taken place and the spine is put in place, examine the patient and see which muscles are tight, which muscles are weak. So once we are able to, then what we can do is we specifically stretch those muscles that are tight, and we stretch those muscles that are strong. And when we talk about strengthening, people have this misconception, this thing like that. Strengthening means exercise. No, strengthening means a lot of factors. A patient, patient walks into my office with different strength capacities. My job as a physical therapist is to understand where the patient stands in terms of his strength.
Right.
Is he able to lift a certain amount of weight and gradually progress him towards the goal? Not start every patient. There is no golden rule that the patient has to do this core strengthening exercises, that core strengthening exercises. That's the reason my patients, we start with a level 1 exercise, a level 2 exercise, a level 3 exercise, and then progress them further from there.
Yeah.
And strengthening takes time. And the same aspect of massage therapy. Some of these patients have chronic tightnesses of the muscles, and we as physical therapists, we do treatments and things like that. But a patient needs the services of a massage therapist to kind of like lengthen the tissue further.
Okay.
In those cases, in our office, because we have a massage therapist available and things like that, we do refer the patients to those people, and that will benefit the patient also. And then we take the aspect of strengthening, and chiropractors, like I said, and in
From my experience personally, if somebody had gotten into a sports injury, or let's say they got into a car accident, I'll take them in. I'll do a full workup on them, X-rays, if they need them, and if the bones are out of line, I'll diagnose that as a subluxation. And my feeling on the whole, my take on the whole thing, once these subluxations are corrected or these misaligned bones in the spine, then we start doing the strengthening, because you have even supply to the muscles. Right, with the nerves?
That's absolutely right.
All right.
So that was the understanding, and the collaboration of care comes in. One other bigger aspect that I also feel beneficial working in an integrated office is also the ability to get reports, the ability to understand the patient much more easily.
Now, do you find it more difficult strengthening these muscles when the bones are all twisted out of place, out of position?
Absolutely,
is it much more difficult?
because the reason is the spine is misaligned. The patient is not in alignment, or not in the stage of what we call homeostasis, or the resting position of the body. So that causes pain, and whenever the patient is in pain, he's not ready to tolerate any kind of strengthening exercise or any kind of stretching.
Do you have a lot of muscle weakness on one side compared to the other?
Yes. Understand that spine, the spine is actually controlled by either side of the muscles of the human body. Your right side is weak, your left side is strong, the spine is going to deviate to the left. Your left side is weak, the right side is strong, the spine is going to deviate to the opposite side. And also understand that the spine is not a single pillar. It's a multiple segment.
Well, it's 24 bones.
It's 20 bones on one top of each other. So every spinal segment can rotate or deviate or side flex and twist. It's like a stack of chips on top of each other.
And
So-
from my experience, at least, when those bones do go out of place, out of position, they will affect the nerves that come out on each side.
Absolutely.
And if they pinch a nerve, whether it's from a bone out of place or a disc putting pressure on that nerve, whatever is putting pressure on that nerve, wherever that nerve root goes to, will be compromised.
Absolutely. And
Whether
I
it's a
have-
muscle, these things go to skin tissue, muscles, organs,
Yes.
and so on and so forth. So if you try to strengthen that muscle, it's going to be weak, and it's not going to grow the same.
Yes. Imagine a nerve to be to an electrical supply to a room. So anything compromised
Right.
on the nerve.
I use
is
that
gonna-
analogy a lot,
Yes.
too.
So it's going to affect.
So the nerve is like the electrical cord, right? The power
Yes.
cord, and the muscle is like the light bulb.
Yes,
right?
the light bulb. So whenever you have decreased intensity as a result of any kind of like impingement of the nerve at the level of the disc, or at the level further deteriorated down, it's going to cause decreased electrical impulse, thereby affecting
Right, it won't function properly.
So we need to address the nervous issue before this thing like that.
All right, so basically the chiro and the PT at the same time.
Yes, that would be much more beneficial to the patient, to this thing. But at the same time, there are patients in which the patient is so acute that they cannot do physical therapy treatments. Then they see only chiropractors.
Right.
At the same time, there are certain conditions where a chiropractor cannot be able to adjust the spine. In those cases, a physical therapist can this thing.
The team approach is definitely the best.
Definitely, it works much better. Like I said, the whole.
And have you been in a practice where you've only been the sole practitioner?
Yes.
And it doesn't work good.
It doesn't work good. The reason is one of the things is, in an integrated office, one of the other things is the patient has to make one appointment for multiple treatments at the same time. So that's going to benefit the patient rather than going to 10 different offices, making 10 different appointments and things.
Excellent.
And I also feel that it's much more easy to get an appointment, with a community center like this rather than this thing, to a specialist. The reason is, on average, like I said, I have a patient who comes with me low back pain. He's acute. I want him to go see an orthopedic surgeon for referral to an MRI to find out what exactly is happening so that I can have a better understanding and I can effectively treat my patient.
Understood.
And it always takes time to find an appointment with an orthopedic surgeon. It's usually a week to 2 weeks of waiting time. By the time the patient is still continues to be in severe pain. With our practice, the best approach is we have a chiropractor on site. The patient can see the chiropractor on the same day, and he will be able to get referred to an MRI or an X-ray to find out what's happening.
Okay,
So
all
that
right.
will save much
So
time
quick
for them.
before we wrap this thing up, I want you to let the audience know exactly where your locations are. All right, so where are you located?
We have 3 office locations. I practice with you in Ronkonkoma, which is our main facility. We do a lot of the services over there. We have an office in
Yeah, Farmingdale, right?
Farmingdale, and we have an office in Shirley. We are mostly located out in Suffolk County,
Okay, so it's Eastern Suffolk.
Eastern Suffolk. You can reach us at the phone number for our practice is 631-805-2850, and our website is unitedrehabphysicaltherapy.com.
UnitedRehabPhysicalTherapy.com.
.com.
Perfect.
We also offer different specialty services. We offer physical therapy, post-surgical rehabilitation for patients. We also do a program called Safe Steps, which is a fall prevention and a balanced rehabilitation program for senior citizens. Anybody who has fall prevention can, talking about elderly, senior people, this thing, they can reach out as 631 Safe Steps. It's a specific program designed for senior citizens.
Okay, perfect. All right, thank you for joining us today, Krishna.
Thank you.
We'll have you on the show again in the future, hopefully. Okay. Thanks for joining us. If you're watching Madhouse TV, please stand by. If you're watching us on Cablevision, we'll see you next time. Thank you.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hello and welcome to the Bridge of Health. I'm Dr. Thomas Dow, and my guest is Krishna. He's a physical therapist today. The point of this show is to educate patients into the team approach and the integrated approach of healthcare, rather than having sole practitioners and being lost in a sea of practitioners. The whole goal is to have everything under one roof and treat the patient as more patient-based care. I'd like to introduce Krishna. He's a physical therapist. Thank you, Krishna. Thanks for coming on my show today again. We're going to do a little bit different today. Krishna is going to be asking me a couple questions about what I do as a chiropractor. I'm certified in a couple things that chiropractors don't usually do, and we're going to touch on that.
Well, I know what you do because we practice together in one of our offices, but I would like the audience to know how your treatments can help patients together. So you've been a chiropractor for how long?
I've been practicing for about 6 years now.
Okay.
As a chiropractor in multidisciplinary practices along with physical therapists, pain management doctors, and so on and so forth, to kind of get what patients where they need to get the easy way.
Okay. Tell the patients, why did you become a chiropractor?
I've been influenced by chiropractic most of my life. I was adjusted as a baby, actually, with the umbilical cord still attached. And back then, in 1984, chiropractic wasn't really accepted the way it is today, let's put it. So there was a lot of objections to that, but I'm glad I did, and I'm still in great shape, as I was then, and I think it was very beneficial to me being adjusted throughout my whole lifetime, and I think that's been a big influence in my decision to help people like I was helped in the beginning stages.
One of the things that the common question is asked is, how long is a education to become a chiropractor these days?
That's a good question. Typically, before you even can apply to chiropractic college, you need a bachelor's degree, which is a 4-year degree in college. And then the curriculum consists of 2 options, either 3.5 years straight through, no summer breaks, three trimesters a year, or you can do a 5-year program once you get into chiropractic college. So you're looking at about 7.5 to 9 years of education just to be certified as a chiropractor. And a lot of people don't really understand and don't think that there's that much involved in the education to be a chiropractor. And I think that's pretty much misconstrued, because the chiropractors do get adequate knowledge about diagnosis, radiology, MRI, and how to treat a patient if they were to walk in your office the next day.
Okay.
Typically, the curriculum for chiropractors is almost more than it would be for a medical doctor, if not more.
Okay.
The anatomy and physiology part, the minimum hours for anatomy and physiology far past medical. The amount of hours in pathology far past medical providers, and other things like X-ray interpretation. They do far past medical providers. Medical professionals are higher trained in things like pharmaceuticals and things of this nature. But as far as the hands-on treatment, you have to go to the chiropractic college.
Approach. Okay. And where do you practice right now? What are your offices and where you
I
located?
practice in, we have 4 offices.
Okay.
We have one in Hicksville, we have one in Melville, We have one in Ronkonkoma, and we have one in Medford.
Okay.
So we're pretty much scattered throughout all of Long Island. You know, we have a lot of practice, but I personally practice in Melville and Ronkonkoma.
Okay.
And I work 6 days a week.
Mhm.
And I'm very hands-on with my patients,
Mhm.
and they love me. They love me for it, you know.
I see that every day, but I just want the audiences to know. What is so different about your approach of treatment, and what are your specializations?
All right, well, chiropractor, as you know, the audience doesn't know, but chiropractors are portal of entry practitioners, which means you can walk off the street, you can go see a chiropractor rather than a medical doctor, and the chiropractor can do the whole workup, whether the patient needs, you know, first, if a patient walks into my office, I do a full exam. It takes me about 30 to 40 minutes. I'm with the patient, asking them questions about what their injury is, what their symptoms are. I do a whole workup, which includes range of motion, orthopedic testing, neurological testing, range of motion. I do sensory dermatome testing. I do palpation. I feel the spine. I look for the misaligned bones in their spine, if there are any. From there, once we do the whole workup, I decide what that patient needs, whether if it's diagnostic testing like x-rays, I decide whether they need MRIs, I decide whether they need to see an orthopedist, maybe they had a shoulder complaint that I can't help them with, maybe they need to see a spinal specialist at that point. I do send out those, maybe they need to go for an acupuncture consult, maybe they need physical therapy. I really decide what they need all in one. But I do work with all those specialties. We do have all those specialties in our location, as you know. So it's very convenient.
Okay. What about your approach of treatment of most of your patients?
All right, that's a good question. If it's something that I can help them with, I will, in fact, start them on a very specific treatment plan to get them to where they need to be. And this usually it consists of 3 different phases of treatment. The first, where we see the patient more frequently. The second phase, where we see him at a moderate frequency. And then the third phase, where we see him less frequent. And by doing this, by correcting these bones in their spine, I get them to where they need to be physically.
Okay.
And that's close to 100% of health.
Okay. All right. And do you specialize in any other, I know that you specialize in MRIs and, diagnostic testings and things like that. There's often a number of times that I've come to you with questions on an MRI that I won't be able to read, and you have corrected me on how to read them and things like that.
All right.
So let's talk about that.
Well, the chiropractic college, they teach you, how to interpret X-rays and how to interpret MRIs and things of this sort. But I myself have taken classes to far see that. Okay, I've taken certification in MRI interpretation course, which was led by Dr. Peisner. He's a neuroradiologist, and he is one of the founding fathers in Stony Brook, where they developed the MRI system.
Oh, okay.
Okay, so the education that I have is very, very good. I often have neuroradiologists, which are the cream of the crop of radiologists, looking at the spine. I have called them in the past and told them things that they have missed on studies. And they were very impressed in some of the things that I picked up that they missed.
Okay.
Being only a chiropractor and them a neuroradiologist.
Okay.
So my training is pretty spectacular.
Okay. How do you think this will help your patients? This advanced imaging, understanding the MRI.
I've had patients that don't know their problem for 2 years, that have come into me, say, listen, doc, I don't know what's going on. I've been to everybody else. I've been to orthopedists. I've been to neurologists. They don't know what's going on with me. Can you take a look at my studies? And I pop in the disc. I take a look at it. I say, look, this is your problem right here. You have a disc herniation that wasn't picked up. And I call up the radiologist. They're more than happy to write an addendum on it. And the patient's happy because they finally found out what's going on with them for the past 2 years.
Yeah,
And this has happened before. These are
definitely seen that
real life things.
There is a I've seen in a couple of MRIs that you have read, from my office when I had doubts that it was not read properly or the report was sold that, they didn't have the technology back then, or they didn't have an understanding of that and things like that. I also know that you specialize more also in MUA. Can you explain the audience what
Sure.
the manipulation under anesthesia is and how does it fit your practice?
Absolutely. Manipulation under anesthesia. Basically what manipulation under anesthesia is a pathway for those patients, and it's only a certain amount of patients. It's not 100% of your patients, but it's probably 2 to 3% of your patients that come in that have been in a lot of trauma in their lifetime, or a lot of trauma due to one event, okay, that have built up things like scar tissue that might be around the joints, and they've been through physical therapy. They've been through chiropractic. They've been through acupuncture. They've been to pain management doctors. They've been to orthopedists. And basically what this is a pathway to try to free up that scar tissue when the person's unconscious. Okay? Manipulation under anesthesia is a technique that was developed, and it's been going on for about 70 or 80 years ago. It's not something new. This is a technique that was developed to stretch the muscles and free up tension in the spine. This procedure is often done in 10 to 15 minutes per patient. And I know it's not a lot of time, but it's an effective procedure. Basically what it is the patient, it's a last end stage before they get surgery on an area. So the patient would come in, I would evaluate them to see if they fit the criteria to even get the procedure done, because there are certain guidelines that we follow. And those guidelines are set forth by the National Academy of MUA Physicians. And these guidelines are the accepted guidelines in the U.S. for MUA. And if the patient's not a candidate, we don't do the procedure. Basically, the patient comes in, they get a whole workup done by me. We then send them out to see if anesthesia if there are any complications for the anesthesia part of the procedure. And that has to be done by either their primary doctor or a cardiologist. And they have to do a workup on them to see if their heart is good, if they have any things that might make it dangerous to do the anesthesia. If everything's good and everything's clear and the patient fits the certain criteria for the procedure, we go ahead and do it. And basically what we do is they get a little bit of anesthesia. They're out. It's considered a twilight sedation, which is halfway between being fully out and being just localized anesthesia. The patient typically wakes up about 10 minutes later, feeling great, increased range of motion. Some patients never have headaches after it. The pain level decreased significantly, and I've had very good results with it. And it's accepted.
And usually, what type of patients are you talking about are the rightful candidates for MUA? What type of symptoms the patients are persistent?
These might be patients that have chronic headaches. They might have chronic pain due to an injury, like a car accident or work accident. They might have all different symptoms, based on. But if the problem is associated by some joints that aren't moving properly in the spine, and that are caused by scar tissue, and giving them these symptoms, they could definitely benefit from the procedure.
Are there any complications?
The complications that are associated with MUA are basically complications that would be associated with the anesthesia part, rather than the actual the manipulations and the stretching and everything. I like to think about it like this. I have a malpractice premium, and anybody, whether they're a dentist or a doctor or a surgeon, their malpractice insurance, the amount of money that they pay per year, is typically associated with the amount of risk associated, right? Right? You've had that before, right?
Yes.
And your malpractice is very inexpensive, right?
Yeah, absolutely.
Because physical therapy is low risk. Well, when I first added this procedure to my malpractice insurance, it didn't raise it a dime. So that tells you that,
it's pretty safe.
It's pretty safe. And there's no increase. Well, as far as the insurance company's concerned, there's no increased risk to MUA rather than typical manipulation in the office, as far as they're concerned.
Now, let's go back to the integrated model of approach. Well, you and me practice together.
Right.
We know how our patients get benefited from seeing both of us.
Yeah.
Let's talk about the audiences out there that are just seeing chiropractic
All right.
services, and how they can they should be how chiropractic alone versus all integrated services should help them benefit better. And in your experience as a chiropractor, what do you think about that approach?
All right.
And how do you think it's going to be helping the patient in a different way than what ideally being in a sole practice as a chiropractor? And a couple of my patients have this question that once I go to a chiropractor, I have to go there for the rest of the life. And I know that that's a misconception because we see the same patients in our office, and we don't see typically every patient more than 8 weeks to 12 weeks. And once the symptomology is down, and we discharge the patients and things like that.
All right, well, let's talk about that. Let's touch on that a bit. So, the approach with chiropractic and the approach with physical therapy are similar, but they have their differences. All right, chiropractors can use some of the same modalities as physical therapists, such as the heat, electrical stimulation, ultrasound. We're licensed to do that in New York, as well as physical therapists are. The difference is sometimes chiropractors will only do the adjustment part of the treatment, and sometimes physical therapists will only do the modalities part of the treatment, but never the two. Now, sometimes patients will go to one of these chiropractors or one of these physical therapists that do only one, they won't get better. And they'll say, "Doc, why am I not getting better?" And the reason behind that is, if once you get into an accident, or once you have a trauma in your life, or once something happens, right? Say your posture's bad, these bones will move out of alignment, and we'll be able to pick that up on X-ray. And once these bones are out of alignment, things will start to grow unevenly. Muscles, right? You've had that
Imbalances.
before?
Imbalances.
Imbalances, right? There's going to be structural imbalances. It's like a domino effect. If they're not corrected, they're just going to continue to get worse with time. More degeneration, more arthritis, right? You see that all day.
Yes.
Okay, so my approach and your approach is to combine both chiro and physical therapy at the same time. Let's take, for instance, somebody just got into an accident, okay? Bones got twisted out of place. Now, in their spine, as you know, the spine isn't one segment. It consists of 24 bones, and these bones move independently of each other, right? The bone will oftentimes rotate out of place, put pressure on the nerve, and wherever that nerve root goes to is going to be compromised. Whether it's a muscle, whether it's a patch of skin, whether it's an organ internal, wherever that's associated with that nerve root compression is going to not grow just like the other side. So if you have a weightlifter or if you have somebody in the gym that's trying to build muscle, they could do as many bench presses as possible, as many squats, but if that nerve in your back is not supplying the muscle properly, it's always going to grow uneven, right? That, in time, will make that bone twist more out of place. You agree with that?
Yes.
So the whole goal of having the chiropractic and the physical therapy as a team, I think it makes the patient, it centers the care on the patient rather than centering the care on the practitioner, right? They get the best of both worlds. They will get the decrease of inflammation with the physical therapist. Will start decreasing the inflammation. The chiropractor will then, in turn, realign the bones in place, make sure the structure is good, and then with time, those nerve roots, whatever the nerve roots are compromised, will make everything grow evenly, and that's where the rehab goes in.
Yes.
All right, then you start your rehab program. We build the muscles evenly to strengthen the structures along to support those bones to keep the new skeleton. And then the person goes and lives their life, no problems, right?
So we're talking about function, which is
Function.
ultimate thing to get back. Okay. Let's also touch about other specialties like acupuncture or pain management, how it benefits your practice, and how integrated you are with that.
Well, we do
practice in your
have
service.
both pain management and acupuncture in our practice, and we've seen, both me and you have seen patients that benefit from both, right? So I think typically the acupuncture, we know a little bit about it. the acupuncturist knows a lot more. So whenever a patient, I think, can benefit from the acupuncture, I will send them for a consult with the acupuncturist. And that acupuncturist will provide the appropriate treatment, if there is any acupuncture treatment, for that patient, and they will get better.
Okay. Now, another aspect of both of our practice is patient education. Okay, that's an important aspect that we spend most of our time in educating the patient. I have spent hours on educating a patient to what is the right posture, to what is the right rehabilitation exercise, or what is the right pathophysiology. And what do you think is the benefit of educating the patients?
Well, you have to educate a patient. The term doctor means teacher, right? So I think it's our responsibility to not only treat the patient, but also educate them on the right ways to lift things, the right ways to get in and out of the car, the right ways to sleep, the right mattress to sleep on, right?
Yes, absolutely.
Because everybody's body's different. So there are things. Posture,
At
right?
work.
The way you carry a bag. A lot of women carry it on one side. It's terrible for your posture. Basically, you need to do the right things in order to keep the right structure. And if you do the wrong thing long enough, it will compromise it. So it's a major part of practice.
Yeah.
is to
One of the
educate.
things we emphasize also in our practices is that because we as chiropractors and physical therapists do get to spend most time with the patient, because usually the patient is seeing us at least 3 times a week. They're only seeing the doctor, the true doctor, who is a medical healthcare professional or an orthopedic surgeon. Well,
Maybe once a month,
Once
yeah.
a month. We are able to educate the patients much better. Every visit we emphasize the importance of posture. We emphasize the importance of corrective techniques to lift something, carry
Absolutely.
something.
Yep.
And
Couldn't agree with you more.
This actually changes over the course of treatment, because
Yeah.
when the patient is acute, there is certain precautions that patients need to follow. And when the patient is subacute, we tell the patients to follow a different set of instructions. We educate them on home exercise program. We educate them on home strengthening program. And one of the bigger things in our practice is we also emphasize very much on mostly patient education, different phases and things like that.
Yeah, and I think that type of education is more important, not in the beginning stages, but towards the end and the
Yes.
terminal stages, because they need to keep these habits, these activities of daily living, and if they have bad posture, if they carry the bag on one side compared to the other, if they have bad sleeping patterns, this is what's really going to carry them for a lifetime when they don't see us.
Okay.
Yeah.
And that's what I'm talking about. We also talk about preventative education. If the patient has ever been diagnosed with a disc injury or something like that,
Right.
yes, the disc injury is going to be permanent. But we know as practitioners that once a disc is injured, if the patient can follow certain precautions, maybe the symptoms associated with the
Yeah.
disc injury are not going to be permanent. And every patient has to understand their health condition and accordingly modify what the activities that they do.
Yeah, it's all about the risk prevention.
Yes.
That's basically, and you are certified in the risk prevention program, right? Some type of risk.
We educate our patients. We do functional capacity evaluations to evaluate a patient to find out how their ability to carry pull push is, especially for people who are injured, especially the spine or extremities and things like that.
Got it.
We set parameters for them of what is your safe lift capacity to understand that, okay, you can lift this thing. If you have to modify a task based upon your diagnosis and things like that, you have to use that lift precaution so that you don't exacerbate your symptoms or prevent this thing from happening.
Excellent.
Okay. Right now, let's also talk about where these audiences can reach you at. What's the best website to follow you?
Okay,
Where
perfect.
are you located?
All right. So we have the office in Melville, Ronkonkoma, Medford, and Hicksville. If you'd like to get in contact with me, you can call me at 631-249-0011. I have a website. My website is www.dowchiropracticpainrelief.com. The site is phenomenal. Check out the site. There's a lot of patient education things right on the website that you could touch base. You could see exactly why symptoms happen, like sciatica, migraines, all different things. So go ahead and check out the website, educate yourself, and yep.
Okay. Let's recap. One of the things that we talked about today is how all healthcare professionals can work together, and I think it's going to benefit the patient much more than anybody thinks. I think in the practice that we kind of do as an integrated office, the patient is definitely the winner.
The patient has to be the winner.
Yes, because it's this
They
approach.
have to. There's no questions.
Okay.
It all has to be patient-based.
Patient-centered,
Yes.
I would say.
Mhm.
All right. Thank you so much for having us and for having me.
Thank you, Krishna.
Hope
Thank
to
you for
come
coming
back
on my
again.
show.
And,
Okay. Thanks for joining us today. You're watching us on Mad TV. Please stand by. If you're watching us on Cablevision, we'll see you next time. Thank you and have a great day.